Can psychopathy be detected in children? Have you ever wondered if psychopathy can show up in children? This question is fascinating and important, especially when considering how it relates to criminal behavior later in life. Psychopathy is often seen as an adult condition, but research suggests that some traits can appear in children as young as 2 or 3 years old. So, what are these traits? Children who might exhibit psychopathic tendencies often show a lack of guilt or remorse after misbehaving. They may be persistently selfish, deceitful, and disregard punishment. These behaviors align with what experts call callous unemotional traits. This means they can be emotionally detached, lack empathy, and do not feel remorse for their actions. Studies indicate that kids displaying these traits between the ages of 2 and 4 are at a higher risk of developing behavior problems linked to psychopathy as they grow older. To assess these traits, professionals use specialized tools. For instance, the Youth Psychopathic Traits Inventory and the Antisocial Process Screening Device are questionnaires designed for children and adolescents. These tools are often completed by parents, teachers, or the children themselves. They measure traits like dishonesty, impulsivity, and lack of empathy. Another tool, the Childhood Psychopathy Scale, helps identify tendencies common in young individuals. Recent advancements have introduced diagnostic tools that can identify callous unemotional traits in preschoolers as young as 3. These tools use behavioral questionnaires and computer programs to evaluate emotional deficits and callous behaviors. Some studies suggest that about 10% of preschool children show these traits, which can predict aggressive behavior and potential criminal activity in adulthood. However, it is important to note that psychopathy is not formally diagnosed in children. This is because their personalities are still developing, and certain behaviors may reflect normal developmental stages rather than a fixed disorder. Psychologists are careful not to stigmatize children, as early traits do not guarantee they will become psychopaths as adults. Instead, early identification is used to guide therapeutic interventions. These interventions focus on parenting strategies and emotional development, aiming to alter negative trajectories. From a criminological perspective, detecting psychopathic traits early is significant. Adult psychopathy is strongly linked to criminal behavior, including violence and repeat offenses. Understanding and identifying these traits in children can help implement early interventions that may reduce future criminality. This aligns with efforts in criminal psychology to prevent severe antisocial behavior and reduce harm to society. While psychopathy is a formal diagnosis for adults, certain traits can indeed be detected in children from a very young age. These findings are vital in the context of true crime and criminology, as they provide opportunities for early intervention that might prevent the progression to criminal psychopathy in adulthood.